Hi everyone, my name is Zoya Matzi and I'm your analyst for this project. We need to plan carefully the stuff for the next year, and as the influenza season is coming, I would like to share with you some important insights I assumed from the data. I have analyzed for you the data of influenza deaths in the period 2009-2017. This is CDC open source data, the population data for the whole country, the data of the US Census Bureau, and some other data from official open sources. Unfortunately, I haven't got the data by months, but only by years. Therefore, I could analyze only yearly tendencies, and I could give you more general recommendation for staff planning seasonality. The analysis of efficiency by staffing for this year and for past periods is the next step of our collaboration. So, the agency is engaged in a very important healthcare sector, provides additional influenza specialized staff for hospitals and clinics in the US during the influenza season. As we can see, influenza is included by CDC in top 20 causes of death for all ages. In first plot, deaths by cause in the US 2009-2017, you can see all causes of death. And where is influenza? This is together for all ages. If you would like to choose any age group, you can do it here. So you will see the range of influenza as a cause of death for age group you have chosen. The second plot you can see is about which group of patients is more gravely affected by influenza. And you can see that most deaths are in the 65 plus age group. Here, you should not mistakenly assume that older people are more affected by the flu. The number of deaths by older people is very high by all causes of death, and this results in the statistic. But it's important to understand that states with the same size of older age groups have different numbers of deaths. The reason can be explained easily. It required the analysis of genetic, social, urbanistic, and other factors. Here you can see two plots about this. The map shows the over 65 population density across the country, also distribution of this age group population over the country. And we can see, for example, California and Florida have the same color, also have the same density of this population. The size of 65 plus population group is the same here. But if you go to the another plot about mortality over 65, mortality across the country, you will see that these two states, Florida and California, have different colors, also different range and size of mortality. So the same size of population group but different mortality. And we should range the states by this parameter for staffing by our agency. This is very important insight that should affect the staffing strategy. Here you can also to visualize only some states you prefer to see. Here is possibility to choose top states to see more precisely how is the mortality here. Also, the next plot is about influenza seasonality, and we can do any accurate forecast until we will know about type of influenza virus will dominate next season. But about the peak of the season, we can forecast with a very high probability. As reported by the CDC data, almost half of the influenza peaks in the last 40 years happened in February, and all peaks were in the period from October to April. That is about how to distribute the efforts during the next season and in which proportion to plan staffing for each month. So if you see this plot, here we see all months when the influenza peak is happened during last 40 years. And here we can see how many times it was happened. Also, 44% of peaks was happened in February. The last 40 years, that is every second year. And all peaks are happened in this period. So we can plan our seasonality as this data shows. From other point of view, it's important to pre-select specialized staff to be prepared to future staff requests. The data on mortality range by age groups shows we have two groups with the highest range of deaths from influenza. 1 to 4 years old children, this one, and over 65 age group people, this one. This range is a place of influenza as a cause of death in list of 20 most causes of death for each age group. So if we see here number 8, that is influenza is on the place number 8 in this list of 20 causes of death. We see that this group, 1 to 4 years children, has range number 6. Also, the deaths causes by influenza happen more frequently for this group as also for group 65 plus age people. The total number of deaths in the 1 to 4 years age group is not very high because of low children's mortality in the USA. But the data shows we need to prepare the specialized staff. The next question we need to answer is how to achieve the goal to avoid the mistaken staffing or to avoid 10% more overstaffing or understaffing using the resources we have only and avoid recruiting of additional staff. The answer is easy and complex in the same time. More than 20% of health workers, according to CDC, were being affected by influenza every influenza season. This factor creates additional demand during the influenza peak and overstaffing by additional workers in other periods. Vaccination is the only way to reduce the incidence by fighting contagious diseases. The two plots show the low level of flu vaccination in adult people in the US and also the low level of motivation. You can see, for example, this last season we have only 41.7% for adult people in US. So if we go to another plot that shows motivation of people, we see this orange part that is answer of people that do not plan to have flu shot for next season. 40% of people don't like to have flu shots. I couldn't analyze which percent of agency staff has got a flu shot, but in any way, that is what we need to work on. And now I would like to say a couple of words about the oldest group of patients. As a final plot, I have the one about the dynamics of death over time by the state in the most vulnerable 85 plus age groups. This is a great generation of our grandparents. They are named Science Generation because of the very hard times they had to live. You can see here three states dynamics as an example, and we can assume that we have these ups and downs dynamic and cannot assume that this are decreasing with the time. Fortunately, this group is very difficult. This is generation of our grandparents, and I would like to say that it's very, very important mission that you take care about them. So thank you very much for taking care of this patient and also for all your work. And let us do a quick summary of things we have done in this analysis.
First of all, our planning must correspond on mortality and not on population size.
You can see the list by mortality here. Is required the preselection of staff specialized for vulnerable age groups of patients. The 1 to 4 children's age group and 65 plus age group need special attention. The preselection of health workers who have got flu shots for the next influenza season is the only one way to reduce understaffing and overstaffing. The analysis of the efficiency by staffing for this year for the past periods is the next step of our collaboration. Thank you for attention and see you next time.